Okay. So, why is a patient's attachment style important to being able to treat patients effectively? Here are my citations. So, why is this important? It could lead to more effective care. It'll lead us, providers or any healthcare professional, to be able to understand a patient better. Could lead to tailored treatment plans where it's based on the patient and not the disease. And will just lead to better communication between patients and their providers. So, our conceptual variables. So, variables that will help explain what we're researching. Patient-centered care. So, this is care that focuses on all aspects of the patient. And then it tailors the treatment plan to the patient and not necessarily the disease. Patient's attachment style. So, this relates to how a patient will communicate based on personality. To give a little more background, attachment style usually is based on the child's caregiver. To simplify it, there are more than 3 different types, but to split them into just 3 categories, there's securely attached, and anxious avoidant, and then neglectful avoidant. So securely attached means the child's obviously securely attached to their caregiver. Anxious avoidant is kind of that middle ground where they are attached to their caregiver but get very upset if their caregiver isn't there. And then neglectful is when children are typically not attached to their caregiver. So, providers' understanding of attachment theory, how the provider understands and applies their understanding to their patients. So, taking what they know about attachment theory and those personality types and then applying it to their patients. So, my research question is, how does a provider's understanding of a patient's attachment style affect a patient's adherence to their treatment plan? So, a quantitative approach is better for this because, one, it's more objective. So, I want to test, are patients sticking to their treatment plan? I am not interested if they are satisfied with their care. I want to know, are they sticking to the treatment plan put forth by their doctor? So, sampling. How do we select the right type of patients? So, by choosing the right kind of patients, we need patients where we can do actual physical and blood exams to see, are they being adherent. Cardiology patients, in my opinion, are the best way to go. So, when treating blood pressure or cholesterol, there are medications they can be given. There are also other parts of treatment, but it's easy to physically test, are they doing it? Whether that's doing blood pressure readings, other physical exams, blood tests for cholesterol, triglycerides, things like that. Like, are they following the treatment plan to help with their heart? So, for that, it would be selecting a clinic to try and recruit patients. There are cardiology specific clinics, and that's where I think it would go. So, this is a non-probability sampling. It can't be anyone in the population. I do need a specific population for this. So, we would tell patients we are testing for adherence, or do they follow the treatment plan based on their personality. So, how will we test a patient's adherence? So, we would start with the attachment style questionnaire short form. Patients will take for themselves. It is 29 questions on a scale of 1 to 5, 5 being most likely, 1 being less likely, and how it relates to them. Providers will take a look at the questionnaire, look at the different things, and then apply that to their patients and what they think their patient's attachment style is. And then we'll do blood tests and physical examinations of the patients throughout time to see, are they being adherent to their treatment plan, whether that's, is their blood pressure going down, is their cholesterol going down or staying steady, or are these things going up or not changing. So, operational variables. Patient adherence. If the patient is adherent to their plan, they are following the treatment plan. So that means it is working for whatever they are being treated for. So, provider's communication due to attachment style. So, how is the provider tailoring the communication on the treatment plan to the patient? So, not a treatment plan tailored to the disease like high cholesterol. What are they doing to tailor it to the patient to make it most likely that the patient will be adherent? So, how will we analyze the data? First, we'll verify the patient's attachment style due to their survey, then compare to what the provider put. So, the ones that the providers are correct or incorrect, and then we will see the provider's treatment plan for patients. So, you are going to have patients with similar attachment styles or the same attachment style. So, then we would look at their treatment plans and see what is different based on the different patient styles, and even how is it different with those subtle things in different patients' attachment styles to help them be more adherent. And then we would do blood tests and physical tests to see if they're taking the medication and following the rest of the treatment plan. So, findings, what can this mean? This could help us better understand how to treat patients. Again, treat the patient, not the disease. So, following a patient-centered care. And this could help push that forward around the nation if it is proven that applying your patient's personality to treatment plan is helpful. This could help communication between patients and their providers. If a provider has a better understanding of their patient's personality style, that'll help them better learn how to communicate and build that trust with their patients. But thank you. I hope you enjoyed.